Hello everyone, today I am going to topic is radiographic imaging techniques. First one, the abstract the evaluation of children with urology complaints or possible congenital anomalies cannot go forward without proper imaging. The mainstay of this imaging include ultrasonography, wide crystallography (VCUG) and nuclear scintigraphy. Each modality its distinct indication and complements each other with the goal of defining the normal or anomalous genitourinary tract. Ultrasound allows for excellent screening of the kidney and bladder in children presenting with various complaints, primarily urinary tract infection for various syndromes that affect of urinary tract. Moreover, it serves to confirm prenatal ultrasound findings. VCUG, while invasive in the gold standard determining the presence of vesicoral reflex and is helpful documenting and analysis postures, usual values, uterocellus and diverticle. Nuclear studies provide helpful information regarding differential function as well as drainage MAG3, but can also help in determining parenchymal integrity DMSA, i.e. carrying venous pills. Finally, ultrasound and nuclear studies are visual urgently studies to help define scrotal pathology, both acute and chronic. Keywords: radiology, pediatric urology, ultrasound, children, congenital. First one is introduction. The mainstay of imaging genitourinary tract of children remains an ultrasound, voiding crystallography, VCUG, and divertic radiography. Using these three modalities, the nature of genitourinary tract remains ambiguous in very few children. In few cases where there remains question regarding the status, urinary tract improvements in CT and MRI now offer the superior. Adjunctive studies may be definitive studies. Spiral CT offers considerable benefits in investigation, stone disease, trauma, and tumor study. MRI continues to mature as an imaging study for complex anomalies, but also may have a role evaluating obstruction and inflection. Next one is imaging modalities. Ultrasound is the most commonly preferred study of urinary tract. It is a quick study to perform, provides very good anatomic detail, and is non-invasive without the use of ionizing radiation. There are several indications for performing ultrasound in children, including detecting anatomic abnormalities that may explain the etiology of urinary tract infection. And fourth one is the primary study of acute scrotum in many institutions. It is routinely performed primarily as a screening tool for congenital anomalies. The indication for performing renal and bladder ultrasound on children. Urinary tract infection, febrile. Urinary tract infection, recurrent non-febrile voiding dysfunction. Prenatal renal abnormal, its abnormality, renal colic. Palpable abdominal mass, lumbrical artery hypertension, hematuria, proteinemia. Family history: polycystic kidney disease, hemihypertrophy, asostema urinary retention syndrome associated with renal involvement. Example for tuberous charge, pectoral back with Weidman, etc. Surveillance of vesicortebral reflex nephrolysis as is hydrocephalus is cystine renal disease. Nucleogenic bladder dysfunction, example for myelodysplasy. Obstructive uropathy, example for posterior urethral values. Next one, the indication for performing scrotal ultrasound children. Normal renal sonogram demonstratic, re-informed shape, parallel orientation to past major, central echogenic focus, qualities with pelvis, venous fat vasculature, surrounded by homogeneous parenchyma. Taken in both longitudinal and transverse views, essential renal length compared against monogamous grade of hyperemesis using society, fetal urology grading system. 61 presence of any renal scarring and presence of duplication anomalies, cystic renal disease, and a deletion of the proximal ureter. A bladder ultrasound should evaluate bladder volume and post-void residuals. It shall also evaluate for such anomalies as ureterus, bladder masses, dilated distal ureters, or other pelvic abnormalities. The contact VCUG remains the preferred imaging study of pediatric bladder. In most cases, the VCUG provides excellent and anatomic information as well as functional information on the bladder and urethra. The study starts with plain film prior to catheterization that may detect structural or bony abnormalities, spinal dysplasia, and abnormal bowel gas patterns and constipation. Following catheterization, contrast is instilled and early anteroposterior film should be performed to access a uterine or bladder tumor. To evaluate vestigial reflex, depth, oblique views of the bladder and renal fascia are taken just before during voiding. Post-void images of the bladder will assess bladder emptying and urethral anomalies. The urethral catheter need not be removed during voidicity. Next one is nuclear imaging. Kidney. There are two types of nuclear imaging of the kidney: static renal excision abnormalities of cortex, such as infection and scarring using acid. Diuretic radiography involves intravenous injection of radiotracer that is reabsorbed by the tubulus. MKG3 or DTPA, timely injection of diuretic. The bladder. Bladder is radionuclide cystography provides limited information regarding bladder autonomy or function. Catheterization of the bladder is required and tracer is instilled. Reflex can only be graded as males, moderate, and severe. The utility of radionuclide crystallography limited relative to the contrast VCUG. Next one is renal ectopia. Kidney develops